Kieran's there.
Hey, Kieran.
Hello, you're in attendees as well.
Is that his
Can't hear you.
iPad?
Oh, it could be.
I'm just looking for the option. Can you see the option, Kieran, for panelists to start video? It's disappeared for me. Can't.
Sam Ashton, they're not at the thing, are they? That's someone else.
Chris has just asked, is someone doing the Discord stage? Daisy asked.
Yeah, you see it is.
Oh, okay, great.
Just trying to. I can't see the option to people to turn on the cameras, can you?
Kieran usually can.
It's normally at the bottom of the screen.
Does he know that he's muted?
Yeah, sorry, I just figured it out. I was just going to say, if you're able to make the other account a host, I can do it on my laptop. That's sorry.
Yeah, I'll do that.
I haven't got two screens. I'm using one as the iPad and one as the
Yeah,
laptop.
if you can do it so you can turn the video on, because I just can't do it.
Oh, does anyone know what the passcode is for this?
We don't have one.
There isn't a passcode. It just should let you in.
Oh, yeah, so you can't get in without a passcode.
You have to put in your email. That's what I had to do.
Yeah, you've got to put your email. I think it's got to be a registered Zoom account, I think. So you managed to switch that on, Kieran? Allow panelists to start video.
Have you made my other account a host? Sorry.
Yeah.
I'm
It
not
was
getting
there
the settings
before.
options. Usually I've got it when I'm a host.
Yeah, so have I, but there's just nothing there.
Okay. There we go. Allow panelists to start video. I've done it.
Got it. Okay, so just keep out an eye for people in the chat should be joining.
Just waiting for some panelists. Jordan's in. PG tips.
So
Mark Heley, there we go. I'll make him a promote to panelist.
Wait for Miceal, James, and then Graham.
Mark should be here now.
Hello.
Hi, Mark.
Welcome.
Hello. Are you okay?
I'm good. Yeah. Good. Thanks. Cheers.
Oh, there's Miceal. I'll promote him to a panelist.
Yep. Just wait for everyone to get on.
Just then waiting for Graham and James.
Give them a few minutes. It's only just turned 6 o'clock. But we can just 1 second. Right. Do you want to start with the introductions or wait for a little bit, or do you want me to do?
We could wait for the 2 minutes just to see.
We'll just wait for give it a few minutes and just see. I'll just need to turn my camera off 1 second. Yeah, quick.
Mags from Releaf says that they're in the waiting room, I think.
Oh, there's Mags, right? I didn't realise they were the one who was going to be talking. Sorry. Promote to panelist. They should have some invite now.
Is that everybody?
We're
waiting for James, aren't we still?
Yeah, I can see him.
Is he there?
Promote to panelist. So are we waiting for Graham, or is Mags here instead of Graham?
Are we what, sorry?
Someone said that Mags from... Oh, there we go. No, we're still waiting for Graham.
Mags, I'm not speaking unless Graham wants me to, but I'm here for support, so that's fine. So I think we've got everybody here. Hi, James. Hi, Miceal. Hi,
We've not got Graham
Mags.
yet. Sorry.
Pardon?
We've not got Graham yet.
Oh, Graham. Nearly everybody then.
Nearly.
How is everybody else doing?
Good.
Oh, hi,
well,
Max.
thank you. Just cycle through the rain.
Okay, so we're just waiting for Graham now.
Sarah, Tommy wants to add him as the mod.
Yeah,
questions.
Well, can somebody do that? Or
It's not here.
I got permission.
why do you need to? I can't at the minute.
No,
No.
no.
So what should we do? Just give it a few more minutes. It's like 2:06 now. I think we should probably just start with the intros.
Yeah, we
maybe.
had somebody run late last time, so I'd say just give it.
Yeah, we'll just kind of do the intros, and then if Graham joins, we'll just kind of catch up because I don't want to keep everyone waiting. I know everyone's time's precious, and just want to thank everyone for coming. Someone's raised their hand. Is that to do with Charlene Rowe? Has raised the hand.
Just let it
I think
allow them
that's
to
just an
talk quickly.
attendee.
Yeah,
They should.
right. Can you hear me?
Yeah.
Hiya, Graham's trying to get in. So I'm not sure if somebody's got a different link for him or something. I'm not a moderator, so I just didn't know if somebody wanted to send him the link. Or if you send it to me, I can send it
Where
to
is he?
I've
Hang
got
on
him
a
on
sec.
Slack.
I'll copy the invite link.
Okay, thank you.
I'll send that to you.
Cheers.
If you just send him that,
Yeah.
he might have to have a proper registered Zoom account. It might be that's what the problem is. It's not letting him in. I know we had to turn the security settings up a little bit after our issues before. He's managed to join. I can't see anyone. Right, okay. Just keep an eye and I'll just go through the intros and everything. Okay, so thank you everyone for attending the meeting with the Medical Cannabis Patients Association. Really appreciate you giving up your valuable time to talk with patients. We've had a few rules to follow for the protection of industry reps and patients alike, and these can be found in the MCPA Code of Conduct, which you've probably been emailed. If you've got any questions or concerns, you can email fern@mcpa.uk. Please be aware, our meetings are live streamed on YouTube for accessibility and are also recorded and uploaded unedited to the MCPA YouTube account for patients and industry reps to catch up on a later date. Please contact us in advance if you have any questions regarding this. So special thanks to Cannabis Cardiff Clinic for sponsoring this month's meeting. As a patient-run, unfounded community interest company, we rely on the kindness of patient donations and industry sponsorships to cover the cost of the services we provide. If you or your organisation would be interested in supporting us in any capacity, please reach out to fern@mcpa.uk. The guests kindly offer us their time tonight are Miceal Zollman, the founder and CEO at Medcan. We've got Mark Heley, he's external relations at Glass Pharms. And we've also got James Clynn Gunn, sorry if I've said your name wrong, specialist nurse at Integro Medical Clinics. And we also have Graham Woodward, who'll be joining us shortly. He's the Chief Operating Officer at Releaf. I'll invite the guests now to just share a little bit more about themselves and your involvement in the cannabis industry. Try and keep it to 5 minutes or under due to time restraints, if that's okay. So I will pass over to Mark, first of all, if that's okay.
Sure. Hi, thanks for inviting me. So I first got involved in medical cannabis in 1998 when I worked with a group called London Medical Cannabis to compile a set of, well, basically the first set of patient-reported outcomes on medical cannabis in the UK. And we did that as part of the House of Lords Science and Technology subcommittee on medical cannabis. And that went very well. And effectively what happened in the House of Lords in 1998 is they unanimously voted to make medical cannabis a legal thing. But of course, nothing happened, as you know. I basically stopped doing medical cannabis at that point and did other things for the next 20 years. And then in 2019, a friend of mine told me about the fact that it had become legal again. I'd been living in California previously. And invited me to form an investment company to look at the opportunities of putting together a cultivation company in the UK. Long story short, that led to the foundation of a company, which then, through various iterations, went on to become Glass Pharms. And what Glass Pharms is a UK-based cultivation company. And what we do is basically turn food waste into medical cannabis. So our entire facility is powered by an anaerobic digestion plant that takes in supermarket and household food waste, and we use the power generated from that and the heat to grow medical cannabis. So we built a custom-built 2.4 hectare facility in Wiltshire, specifically to grow medical cannabis for the UK and for UK patients. So that's me.
Sorry, thank you, Mark. That's great. Can I pass to Miceal from Medcan?
Hi, everybody. Thanks for having me again. My name is Miceal. I'm one of the founders and I'm the CEO of Medcan. Medcan are a fully licensed, fully indoor cannabis cultivator based in South Africa, in Johannesburg. We were one of the first to get a license to cultivate medical marijuana, and we began exporting in the early 2021 when we began shipping to the UK for the very first time. We're quite active on all the different forums. So I'm sure that many of the panelists listening have engaged with our team in the past, but happy to answer everyone's questions this evening. We grow fully indoor under lights, hydroponic, and we consider ourselves to be sort of like a craft cultivator. So not huge batches, relatively small batches, and we try to maintain a really high quality of the products for every batch.
That's great. Thank you, Miceal. I'll pass it over to James. He's the nurse from Integro.
Thanks for having me. So I started in cannabis in February 2021, and I started off at Life Group, controversially, and really kind of learned the trade there. So in terms of, applying that kind of healthcare knowledge that I had from NHS Scotland and applying that to the cannabis. At that point, the stocks and the kind of the products weren't quite there in terms of availability. But it's kind of developed as it's gone on. I'm now working at Integro clinics, and we are seeing much more sort of naive cannabis patients, and really kind of honing in the trade there, and actually the art of clinical practice within cannabis. But I've loved it. I've really enjoyed it. I mean, if you told me 5 years ago this is what I'd be doing, I would have absolutely laughed in your face. There's no way. But yeah, it's a very interesting journey. I'm really excited about the future as well. So what kind of work we can do to support patients moving forward.
That's fantastic, James. Probably leading to our Normalise It campaign. That nice segue later. Shall I pass to Mags and Graham separately from Releaf? Go on, Mags first then.
Thank you. Hi, everybody. So I'm Mags. I have just started at Releaf. Some people might recognise me. I have been working on Project 2021 at Drug Science for the last 3.5 years. So I came to the medical cannabis space in 2020. And I started just a few weeks ago with Releaf as brand marketing manager. And part of what I'm going to be doing is really putting patients at the forefront of our work and how we talk about our services. So I'm really, really excited about all the stuff that we've got in the pipeline that I'm sure Graham might allude to in just a moment. So I'll pass over to Graham.
Thanks, Mags, and sorry, I must apologise, everyone. I had real trouble getting into the link, but that was my fault, so I apologise. I'm Graham. I'm the COO, so Chief Operating Officer at Releaf. I'm a psychiatric nurse by background. I was the first nurse in the UK to be given a licence to set up a cannabis clinic, so I set up my access clinic. I then was the medical director at Lever Clinic, and I got them to their outstanding for well led, and I now work at Releaf. My background predominantly was in OCU, so opioid use and crack disorder. So I spent 15 years working with heroin and crack users and other substances, and also cannabis was part of that, the addiction services that I worked in. I joined Releaf in November, and I'm really interested in hearing. I've not attended one of these patient forums before, despite the fact being here since cannabis was legalized in 2018, November. So I'm really interested in the conversation and the questions that are going to come forward. And thank you for inviting me.
That's no problem at all. Great to have you on, Graham. and Mags, as I do recognise you from other Zooms. But yeah, really fantastic to have everyone on today. And thank you for introducing yourself. We've just got a quick reminder that we've got our Normalise It campaign has been launched. It was launched a few days ago. We're basically creating a database of medical cannabis friendly venues. We've got a sticker scheme and we've got flyers that you can put in your window, and we hope to have a database, so a searchable database, and then hopefully an app that patients can just put in the location. It will find the nearest cannabis friendly venue to them, kind of thing. So if anyone's interested in that, you can check out the Normalise It page on our website, which is www.mcpa.uk. We're also calling out to patients to submit photos, videos and testimonials for the campaign, and further details are available on the website and the Discord server. And throughout the month, questions are gathered from weekly meetings, social media, our regular Zoom meetings, and the Discord group to be asked in these industry rep meetings. Kieran is the co-founder of the MCPA. I'm the founder. He's going to be doing the rest of this segment, so I'll pass over to him now.
Thank you, Sarah. So before we start, we'd just like to remind everyone, while we try to ask all questions, unfortunately, some may be added too late, some may have already been answered in our Discord, and some questions may have been amended or removed as they were deemed inconsiderate or otherwise inappropriate for the particular guests that we have here this evening. So if you'd like to ask any of our guests a question this evening, please use the Q&A chat section of this Zoom webinar, and we'll ask these questions later this evening. Okay, so I think we'll start with Mark Heley from Glass Pharms. So the first question the patient has asked is, how is your operation different to the current production model, and what benefits do you see this having for patients?
Well, the whole design of the facility is really thought through from a patient perspective. So what we really looked at was one of the fundamental issues, I think, that's been holding back medical cannabis in the UK is really the out of stock issues that have been happening that essentially are kind of built into the import-based system. So what we designed is a system where the plants essentially move through different climate zones. They're based on a container system which is about 5 meter by 1 meter wide. About 30 plants in one container, and those move through the facility on a non-linear conveyor belt, so effectively a giant trackway, and they move through the different climate zones. This basically gives us the ability to do multiple different cultivars in the same time, and it also allows us to do continuous harvesting. So what we're doing is basically creating a giant cannabis factory where small plants clones are going at one end. They move through the different climate zones according to essentially where they're at on their journey. And some cultivars will move quicker than others. And then what happens at the other end is that we're harvesting frequently. So we harvest at least 3 times a week in perpetuity from having set up. So really what we were trying to solve, and what our purpose is basically to provide different cultivars consistently to UK patients. And what we've really invested in is making a system which is highly standardized. So that's essentially we differ from a lot of other cultivators, and that kind of the way that we do things is quite unusual in that respect.
Yeah, definitely. I appreciate you letting us in on that process. So our next question is for James Gunn, not the director, but the brilliant nurse from Integro. So your question from a patient is, what was your nursing background before becoming a cannabis nurse? You're on mute, James.
Hey,
oh, there you go.
There we go. Yeah, interestingly, I started off as I always knew I wanted to be a nurse from a child, from when I was a kid. My parents were like, no, you want to be a doctor, James. But no, I always wanted to be a nurse. And I started off as a carer in 2004 and then qualified in 2009. I've had a really interesting career, kind of travelled all over the UK, worked and lived in Northern Ireland. Predominantly been in Scotland, worked a little bit in England as well. I was really lucky in that I had a really sort of interesting, varied career. I, at one point, was a sort of a regional manager for the north of Scotland for complex care needs. Laterally, my last post was NHS Scotland, NHS Highlands, and I was a senior charge nurse for them. So at that point, I was managing 2 hospital sites, and we were building a third. And that role was really using all of my previous experience in terms of change management and implementing change, but also having that direct clinical role as well. So 50% of my time being completely clinical, and 50% of the other time being sort of system development and that sort of stuff. So laterally, we'd moved from a building situation, healthcare system, to more of a community orientated type situation. But what that means is that I have lots of experience with MS, Parkinson's, cancers. I've had a really varied kind of patient experience, demographic experience. And ultimately, I think the other part of that was kind of how that differs from working on a ward or GP surgery. And actually, I don't think it does. I think the patient contact is exactly the same. The responsibility levels are completely different. You know, we're only looking after, I'm only looking after a small part of somebody's treatment, as opposed to looking after the whole thing. But yeah, I've been very lucky, and even luckier I'm doing what I'm doing now.
Brilliant. Thank you for sharing that with us. So our next question is for Graham Woodward from Releaf. You did share a little bit about this at the beginning, but the patient has specifically said that we understand that you're a relatively new addition to the team at Releaf. What drew you to the company, and what is your vision for it in terms of patient outcomes and clinical care?
Wow, that's a multi-layered question, and let me go back. What drew me to Releaf, to join Releaf? So I left Lever Clinic in the winter of last year, September, October time, and I was considering what I was going to do as a future, coming towards thinking about my latter years of retirement. I know it seems very odd to talk about retirement, but you have to think about it sometime. And I was approached by various companies, clinics, and I met various people, and I met the guys at Releaf, and I was really astounded by the platform that they use, the welcome box. I don't know how many people are aware of the welcome box that we give out to patients, which is a starter box, which is a vape. Not just a vape, but we call it a puck rather than a grinder, a container, the vape machine itself. So for patients who have never vaped or used cannabis in that way before, there we go, as modeled by the lovely Mags. If you want to open the box up, I feel like I'm on some kind of game show. This is brilliant. And in the box, it's got all of the leaflets on how to use the vape as a starter pack. You can also get the vape. There you go. You can also get the literature, the patient information leaflets in other languages. So if English is not your first language, so all of the stuff, and the patient platform. So the patient platform is completely bespoke, built for medical cannabis. I brought Miceal to the UK. From those of you that don't know Miceal, Miceal was the platform that was being used in T21. And I've looked at other platforms, EMIS Web, all of the platforms that are out there. And I felt that the PMR, the patient medical record system that Releaf are using, as well as the box, was really groundbreaking. And I truly believe that we are going to support patients the best way we possibly can. Better than, that's probably not the best thing to say, but better than you could find in other clinics. And I don't want to be controversial in saying, you know, we're the best clinic, but we are striving to be the best clinic. That's our aim. And if you saw the box that Mags has just put out there, and the patient platform and everything that we actually do. Also, obviously, in the box, I don't know if Mags saw, but there's the cannabis medical card. And I know there are medical cards out there already. This particular card, it comes in the box, so it's just part of the package that you get when you join us. Yeah, perfect. It has a QR code on it, so you don't have to carry any copies of your prescriptions around with you. The QR code links directly to your medical records. And I know what you're going to say. If you lose your medical card, does that mean other people can see your information? But they can't, because when you scan the QR code, it sends a text message to your phone with a unique identifiable code that you put in, and then you can see your medical records. And of course, then, you know, should you need that, and it's the same as a most cards, you know, the same size as a credit card or a driving license, etc., etc. So all of those things that Mags has just shown you, the things I've talked about, are what drew me to Releaf. And the team here are really, really, really striving. The minds of the team are really dynamic. So I'm really happy being here, actually. Really happy.
Wow.
Is that all? I mean, is that every bit?
Yeah, no, it's definitely some bold claims. I was at the patients conference in November and I got to see the pack firsthand, so it's certainly very interesting. So the next question we have is Miceal, and the patient has asked, would it be possible for you to provide smaller sample-sized options of flour, say 3.5 or 5 grams, so patients are taking less of a gamble with new products? It can become quite expensive and wasteful for some of us to purchase larger quantities only to find that medicine isn't suitable for our needs. So I think you've talked about this before, but it's certainly something that patients are passionate about. So if you could share about this.
So this seems to be a recurring question. I would say, so we're a cultivator, right? So we get told what rules to follow by our importer. We get told sort of what the market or what the market will allow. And let's say the advice that we've received is that 10-gram bags or 10-gram units is what is not popular, but is sort of makes sense to ship. You have to consider that when you're shipping, you know, if a patient orders 3.5 grams, then you have to post it or ship it, the cost of shipping, the process, the administration of a doctor then having to remember, or a nurse having to remember, okay, I need to write this script for 3.5, for 5, for 10, and then having to send those different scripts off at different times to different pharmacies and different clinics. I think for now, the standard unit of measurement appears to be 10, although I'm aware that there is, I think Touré sells 15 grams. But I think for the most part, 10 grams is kind of, 10 grams appears to be the sweet spot, that it makes it kind of cost effective to ship it to the patient, to their door, and also not have to worry from like I would say from a logistics point of view, but also from a doctor having to remember to write the script. I know it's not really the answer that the patient's looking for. If we were told tomorrow that, hey, you guys can now, we would recommend doing 3.5 grams, we would go for it, I'd say. But to keep things relatively simple and relatively cost effective, it seems like 10 grams. I remember a while ago that 5 grams were available. We prepared artwork, we prepared packaging for 5 grams. We never ever sold any 5-gram units of our product. It was always in the 10-gram units. I think it would be a hard time in terms of doctor education and clinic education to get the message across that there's now a 3.5 gram unit, there's a 5 gram unit, there's a 10 gram unit. I think it would cause a little bit of confusion and chaos. But again, we're the cultivator. We get told, I wouldn't say get told, but we go according to what the advice that we're given. If we were told tomorrow that, hey, 3.5 grams is an option, we would definitely explore it. We're not against it. I think something for that patient or the person who asked the question to consider, though, is the cost of shipping a 3.5 gram is way more than the cost of shipping a 10 gram. And so would you perhaps be willing to pay more for a smaller unit? And I don't think many people would. And so that's also something to consider as well.
Okay. No, thank you for sharing on that process. I just want to remind...
Oh, sorry. Could I comment on that? Is that
real quickly? If I could just say to everyone, just because I need to say to everyone, just because we do have limited time. So if you could keep the answers to about 2 minutes or less, because I've got about 10 or 15 more questions to get through by 7 o'clock.
I'll be very quick. Go ahead. So as Mark alluded to, there has been supply chain issues. So if you're going to give a patient 3.5 grams, potentially there will be a delay by the time they get, and it works well for them, it's efficacious. Then potentially, if there's a problem in the supply chain, that means that 3.5 grams isn't going to make a continuous treatment episode. So therefore, is that beneficial? That's it. That's all I had to say.
Okay. All right. Well, so we just need to move on to Mark Heley, so Glass Pharms. So what challenges are facing in becoming the first UK cultivar to have products made available to the UK market?
In less than 2 minutes.
Do your best.
Yeah, I mean, it couldn't be more challenging in many ways. It's kind of a miracle that we've managed to get to where we are at. It's not as if there is a regulatory framework which sets out how you become a UK-based cannabis cultivator. So everything we've done, we've had to essentially invent, and that's what we've been doing since we began doing this. So, you know, it's definitely, the regulatory environment is you could say borderline hostile. It's not here to essentially encourage medical cannabis as an industry at this point. I think that is something that would be great to see. We're basically tolerated rather than encouraged. I think then the other thing is that you also have to come up with a business model that is going to work in this country. And the UK is a high regulatory type of country where, you know, a lot of the options for cannabis cultivation are just not going to work for various different reasons. So essentially what we did is pair getting regulatory approval with a business model that was based on sustainability, because that allowed us to bring in investment that was based on, you know, basically the energy transition. So, you know, this is ultimately, it's horticulture. And, you know, what we did was basically go to a sustainable asset fund that understood what we were trying to do on a kind of sustainability basis. So you've got to navigate the regulatory environment, and then you've basically got to come up with a business model that works in the UK, and those are not easy things to do.
Thank you. So the next one is for Mr. James Clyde Gunn. The patient has asked, you did share a little bit about this earlier, but the patient specifically asked, how does your current practice differ from working on a ward or a GP surgery? You're on mute again, James.
It's a lot. I've got 3 cats. It's always best to be on mute. Yeah, in that it's not much different, if I'm being honest, because what we're doing there is we're using all the traditional, all the models that we would use within nursing, and apply those. So, for example, whichever sort of health condition it might be, there is common sort of gold standards that you'd work towards within those conditions, and we don't vary from those at all in terms of when we're taking pain assessments or, you know, an MS assessment, whatever it might be. It's very tailored, specific, and I guess that's not much different in that when you are having that contact with the patient in the NHS, more often than not, it would be that the patient is sitting in front of you, and I definitely think that as a clinician, that's something that you kind of have to change your practice ever so slightly, in that you've got to be a little bit more aware of the patient's environment within a small box, and maybe ask certain questions that you maybe wouldn't ask otherwise to get detail. But really, it's not entirely different. It's not entirely different. We're just we have less responsibility for the overall patient's condition, as in it might be a specialist pain consultant that would be leading that, and we would feed into that as a multidisciplinary team. Yeah.
Okay, thank you. So back to Graham. So I've got a few questions here that are very specific towards about the patient ID card that you were sharing earlier. So if you answer maybe these specific points, don't worry, we'll get to come back to this subject again later. So the first one is, the patient asks, why does Releaf believe a clinic-based medical cannabis ID card is the most prudent option for protecting patients?
It's not overall, it's an added value, I think. We can't protect, by giving somebody a card, you're not going to protect them, are you? But what you're doing is, if they are stopped or they are questioned about the medication that they have on them, they can provide as much evidence as they possibly can. And we think the card and the QR code on it that syncs to their records is a benefit, but it's not a foolproof system. Cards are not a foolproof system, because obviously cannabis used in the community is still illegal if it's not proven to be your prescribed medication. And whoever stops you, if you're stopped by the police and they decide that it's not in its original packaging, it's legacy cannabis rather than prescribed cannabis. So we're trying to think of everything that we possibly can to support patients as much as possible. But of course, it's not completely foolproof.
Okay, all right. Thank you for sharing on that. We'll definitely come back to this subject. So the next one that we have is for Miceal, and the patient asks, "What are your thoughts on medical ID cards? Is this something that?" Yeah, it's a very specific question. So is this something that is offered to South African patients? And is it something that you'd like to see introduced in the UK, and share with us your reasons why?
So again, the answer to most of the questions that I get asked is we're just the cultivator. We cultivate the flower. So I've got no thoughts. Anything that makes it easier for a patient is a pro from our point of view. So if a card makes it easier, if it makes it more difficult, got no real views on that. In terms of patients in South Africa, South Africa is quite loose when it comes to cannabis. Cannabis is, culturally in South Africa for a very long time. It's been readily accessible, freely available. I know of some places that are springing up that allow you to become a medical cannabis patient, but for the most part, I think most people in South Africa, cannabis is really easily available, freely available. And I think you're able to cultivate in your house, you're able to possess. And so it's not as big of a deal, let's say, as in the UK, where you can only get it medically. You need to prove that you can get it medically. South Africa is completely different.
So real quick, so I understand, Mark, you're also a cultivator as well. It would be interesting to get another clinic perspective on this. James, do you have anything you'd like to share on this subject at all? If not, I'm happy to move on to the next question.
I think that a legal prescription is enough. I'm very basic like that. If you've got a prescription with your doctor's details on it, and it's clearly a proper prescription, that should be what you should be relying on, along with maybe a letter if you do need one, and the clinics will provide it. I worry that patients might pay for something that ultimately they don't need. They just don't need, and I do worry about that, especially the sort of the financial aspects for patients. Patients just need to know that their specialist consultant, who is specially registered on the GMC, has prescribed them their cannabis. Ultimately, we would have a conversation with the patient in terms of how you might engage with police, housing association work, and we will provide information and support around that, because we've got lots of experience in it, how best to approach a situation. And quite often that will be a conversation that we'd have with the patient. But yeah, I'm not a big fan of these cards. I don't see the point.
I appreciate your input on this, James, very much. So I'm going to move over to Mark. So the patient has asked, in terms of pricing structure, and without sharing specifics, as we know you're unable to give these at this stage, where do you think your products will sit in the market in comparison to what is currently available? Will there be a premium and more budget-friendly ranges available?
Yeah, so the first thing we've set out to do is to cover, basically to be complete. So we're cultivating type 1 high THC cannabis, type 2 balanced THC to CBD, and also high CBD with small amounts of THC. So within that kind of range, there will be more budget options. But what we've done is essentially our pricing structure is based on how long it takes us to cultivate them. So in development, what we've done over the last couple of years is do research to find cultivars that will grow relatively quickly. So, for example, with a 7-week kind of flowering phase, and we've got other cultivars which require a longer time, more like 9 to 10 weeks, and those tend to have a higher terpene content in some cases. So there'll be a kind of more budget range and a more more premium range for sure. And they will also, essentially, we're cultivation as a service. So you might find us providing our flower for other brands. Where we'll sit in the market, I think we'll be kind of in the middle at the beginning. So there will be a range from towards the bottom, but it won't be. I think not that when we're talking about a premium cultivar, it will be like a little bit more, not a huge amount more. So effectively, what we set out to do is to grow things which are going to be useful prescribing options, and that's our strategy.
Appreciate that. As a patient, I definitely appreciate more option available on the market. So moving back to Graham for this subject again. So the patient has asked, how will Releaf ensure other patients who are not under Releaf's direct care will not be discriminated against for not possessing a patient ID card? And how will you make sure that your marketing does not cause the same confusion for police officers as the CAN card has done in some instances where the card itself has taken precedence over a legal prescription?
Oh my gosh, these are very in-depth questions. And of course, we want to make sure that every patient that wants access to medical cannabis has access. We didn't produce the card to segregate a bunch of patients who have cards and who don't have cards. We would just want to, the patients that come to us who are cannabis naive, obviously are a little bit nervous about having cannabis on them, whether that be oil or whether that be flower. It's just to give them some more reassurance. It's not to say that these patients deserve better treatment than patients at another clinic. We're just providing it as an extra security blanket, as it were, that they can, and also they can access their own, by scanning their own QR code, not only can they access their own medical records should they need them, there's also a wealth of publications and research on the website that they can access through that card. It's not just to show that they're a medical cannabis patient. But I think to say that how are we going to support other patients that are not part of Releaf, well, that's why we're here. That's what we're trying to do. We're trying to make sure that how many 2 million patients, 1.8, depends what literature you read, all can have access to medical cannabis if they wish so. If they don't want to access it through a clinic and they still want to go through their legacy market, that's up to them. We're not interested in trying to segregate at all.
But I think the question is not so much how are you going to support other patients, but rather how you might combat the potential confusion it might cause that the patient ID card takes precedence over a prescription, like James says, that essentially is what we are legally required to have. So I understand, obviously trying to make sure that every patient has some way of combating that sort of stigma, that sort of fearful situation where they might have to come into somebody of in authority. But is there a way that Releaf is specifically going to combat the potential confusion that might be caused to police in that situation?
Well, I think firstly, the police, I know the police are still confused. I get calls from the police saying that this patient says they're a patient of yours and that this cannabis that they're carrying, and we know cannabis isn't legal. And then that's from the Met. I know that some departments of the Met are not aware that cannabis is legal to prescribe. However, excuse me, we're, as I said before, we're not trying to segregate, but over the next 6 months, we are trying to spend as much money as we possibly can on patient awareness, on public awareness. So on public awareness, that since November 2018, as we all know on here, medical cannabis is legal to be prescribed and to carry if you use your cannabis. It's not, so the only thing we can do is patient awareness and the media awareness as much as we can do to make the general public aware that what somebody is doing using medical cannabis or is not illegal. I mean, it's quite a broad question, isn't it? It's almost making Releaf as an organization. We'll work with whatever patient groups want to work with us to make it a medical cannabis or cannabis legalization of the prescribed cannabis as widely as possible. So we're always open to suggestions from patient organizations, patient groups. And as I said, we're going to be spending a large amount of our time over the next 6 months on advertising, on patient awareness, on public awareness. And I know soon we've got 420 coming up, haven't we? So there's that as well, which is also more promotion of awareness. Have I answered your question or not really?
I will say personally, I've still got concerns, but we'll come back to this topic. It's a very divisive one indeed. But we'll come to James at Integro. So as you're more patient facing and spend more one-to-one time with patients, do you feel you're able to take common patient concerns to the higher ups and encourage more responsiveness?
Yes, without a doubt. And ultimately, actually, traditionally, the nurse role, the core role of a nurse is to advocate on behalf of the patient. And that is including the system that we work within, outside organizations and agencies, outside systems. It might be that, well, a good example of that would be the oils the IPS have. So there was, for a long time, they were very expensive, and the clinicians were kind of jumping up and down about, getting the prices reduced, especially amongst the most popular oil products. And we just wanted to make sure that actually everybody had access to that. Claire at IPS, she was really good. She came back and she was like, give me a couple of months and we will look at the prices. And she came back and the prices were significantly reduced across the board with their oils. So yes, it is possible. And us nurses really know how to throw a strop, right? We will throw a strop on behalf of our patients, no problem at all. That is our job role. So yeah, ultimately as well, it just doesn't have to be with the internal organization. We will, I'm constantly having conversations with housing associations, social work departments, the police, and it's this ongoing conversation and just making sure that we engage with all of these agencies in a sort of a positive, friendly manner, and try not to be, oh wait, you don't know it's legal. It's an opportunity for you to educate and support, and that's how I see it. So I think, yeah, and actually it's a real shame that there's not, nurses in this industry are like hen's teeth. There's only a couple of us, and ultimately we are best placed to look after patients. We are. And it's a part of our core role. It's what we do, and I would definitely like to see more nurses fighting the corner for patients. Yeah, without a doubt.
That's great to hear. Thank you. So our next one is for Mark. Do you intend to incorporate customer feedback to continually improve your products? And if so, how will you facilitate this?
Well, essentially, we've just been talking to patients for a long time now. In fact, it was discussions with patients and clinicians that have led us to choose the cultivars that we're cultivating. So it's an ongoing thing. I mean, a lot of it's been conversations that the team have had with patients and with clinicians. I think, feel free to message us. Send us an email through the website, which is glasspharms.com. We read them all and answer them if we possibly can do. We want to have a really good feedback loop. We haven't really thought about like what kind of structure we'll have when we're up and running. I think that essentially for us, it's an ongoing process of having conversations with people and listening.
Okay, brilliant, thank you. And back to Graham. So from your perspective, what are the most pervasive issues affecting medical cannabis patients at the moment, and how do you and your organization plan to address them?
Pervasive. Well, whether you include this or not, I think the cost is prohibitive for patients. Some of the medications are incredibly expensive. There's still, as you're aware, Kieran, and I'm sure everyone in here, there's still a real misconception around cannabis and whether it's legally prescribable and whether you can use it. And I think people still look at cannabis as a curse. It causes, of course, the old adage that it causes schizophrenia, etc., etc., etc. So I personally think it's trying to break down every myth or every urban myth that's been spoken about around cannabis, try to break down those barriers and re-educate the community, the public.
That's brilliant to hear. It's similar to what we're trying to do at the MCPA by trying to normalize the use of medical cannabis. So I do absolutely agree. Stigma and cost is certainly a big issue for patients. So let's go back to Miceal. So do you have any news about Medcan's plans for the rest of 2024?
We have plans. Whether the plans pan out to be reality is a different thing. But no, so we We just brought back the T24. I think I'm allowed to say that, but yeah, so the standard TS24 is back in stock now. The plans for the rest of the year are to continue cultivating. We will hopefully have a new product on the market by the end of the year. I can't say too much about it, but we will hopefully, as a cultivator, be cultivating. I don't say hopefully, we are cultivating a new strain, but it's going to take some time for it to be ready and available on the market. But the plans for us are, again, we're a cultivator. We cultivate cannabis flower every day, and so we'll continue cultivating for the rest of the year, and we'll ensure that nothing goes out of stock and that the products are always available. That's the plan, really, and keep delivering.
Yeah, that's fantastic to hear. So more sustainability, sorry, consistency, and I love it. So I love the T19. It was very helpful for sleep. I'll be looking forward to seeing what Medcan has in the future. So back to Mark, do you see regulation changing in time to allow for smaller scale producers? We're aware that at the moment there is a significant financial barrier in getting a facility up and running and obtaining the relevant licenses.
Yeah, it's difficult to say, really. I think that, as I said earlier, you know, the regulatory environment in this country is borderline hostile rather than you know, constructive. It's really, really hard. I think that for smaller scale growers, I mean, it's certainly possible to do it. It's just you need to be very, very persistent to get something up and running in this country. I think it's always difficult to say how the regulatory environment is going to go. What I'd hope is that as the industry matures, what we'll be able to see is more constructive engagement with government and the ability to regulate for medical cannabis rather than kind of be in a position where we're just basically tolerated without the kind of the environment really being designed for patients, basically. So it's really difficult to say. I think that it's always going to be quite difficult to do cultivation in this country, and I don't think size is really the issue. It's more the level of persistence that you've got to have in order to get through the hurdles which are put in front of you. There's significant barriers.
Yeah, in this country, we've definitely still got those issues. We tried to apply for many different statuses, and just having the word cannabis in there can be a red flag for some of these regulatory bodies. So we'll move on to James here. So the patient has asked, how would you like to see the cannabis industry change in the next year? Next year and the next 5 years, and what do you think personally and Integro as a company can do to enable this? You're on mute again, James.
Sorry about that. I think in the first year, I'd love to see a range of new products. You know, I'd like to see different types of products and different types of delivery methods. You know, I think that I would be really interested to see a producer that's more focused on female health. And I think that's going to happen. I think Canada will be coming in, so I'd love to see some, you know, producers on this side of the ponds to be producing stuff. So yeah, I think female health definitely, so perimenopausal symptoms and sort of oil specific to that, and vape specific to that, and maybe some flowers specific to that. I know that Medcan, they've got CBG in their strains, and a lot of my patients appreciate that as well. So I think I would like to see more of that. In the next 5 years, I have been really totally fascinated by what Mark's been speaking about, and I would love to see people like Mark be able to operate within this country and feel like it's blossoming, that they're able to function, they're not just tolerated, that they're welcome, and they're creating an economy for us as well. So so that's definitely that answer changed, by the way, after listening to Mark. But yeah, I would love to see a kind of a better legislative kind of environment, and that includes for patients as well, because ultimately what we've got is the doors cracked open just a slight, and we have the gatekeepers, myself and the other nurses and consultants who are very highly specialised in their fields. And actually, I think there's something around about making sure that if there is a next lot of legislation, that we democratise it a little bit amongst other healthcare staff, so that maybe even private GPs can do initiating prescriptions, initial consultations, without having the oversight of a specialist consultant, which costs a lot of money. We cost, specialist nurses, specialist consultants, we cost a lot of money. So I think there's something there that can be done that would be felt quickly for patients in terms of bringing down the costs. But I think we've got to be careful. I think we've got to keep the gold standard over the next 5 years. We've got to keep the profession up. We've got to keep the reputation of the cannabis industry well, and make sure that we're serving our patients well. And I think that'll see us through to a next lot of really good legislation. I've always been worried that something might happen, and ultimately there would be some kind of focus on our industry. And that's not happened yet. We've got to keep that gold standard working to best practice.
Thank you. So we've got about 2 or 3 questions left. So we'll move back to Graham. The patient has asked, how has Releaf ensured patient consensus supports the release of a patient ID card? I'd be very interested to know if Releaf had completed any kind of surveys with patients involved.
Sorry, that there was a couple of parts. So
So the patient asks, how has Releaf ensured patient consensus supports the release of a patient ID card?
Well, when patients join the clinic, they have to give they don't have to, obviously it's part of the terms and conditions, but part of the process of onboarding with us is you have to put your picture of your face on the screen, so it uploads your picture to produce the ID card. Of course, you can decline that. You don't have to say you want the patient ID card. If you don't want it, you can decline it and move on. We only give patient ID cards to patients that actually want them. If they don't want them, they don't have to. They're not paid for. They're part of as Max showed you, the box that we give out, and they come with that box. They're not an additional cost or anything. They're with that patient.
I think it's specifically maybe before the release of the card, was there anything that was done specifically to see if this was something that the community was in favour of as a consensus?
I think either Charlene may be, because as I said, Kieran, I only started here in November.
I know, I understand.
And Releaf have been going since April, so they've been going a year now. So what the initial setup was, I'm not sure of, but I don't know if Charlene, who's on the call, could answer it, or I don't know if Mags. I don't think Mags is even newer than me, so unfortunately I can't answer that. But I can come back to you with an email.
Yeah, if it's not something that can be answered this evening, that's totally fine. Yeah. Does Charlene want to share anything? Do you want to raise your hand? We can unmute you. No. Okay. No worries. We'll move on. All right. So James, the patient has asked, how do you feel your experience as a cannabis patient yourself influences your professional practice? Oh.
Ultimately, I think it's made my practice more human. So, quite often I recognise the fact that patients have been through the system, they've been through the healthcare system, they've had their diagnoses, they've maybe tried several treatments, several interventions that have either made them worse or hasn't worked at all. And ultimately, I'm able to bring my own experience of that as well, which isn't dissimilar to what the patient has been through, and bring that understanding to the table. Like I said before, there's always the gold standard within practice, and Integro will always try and follow that. Quite often, it might be that it's shared experiences, so shared stigma experiences, and I maybe be able to help the patient approach those issues a little bit better, or just having a better understanding of the struggles a patient might face. For example, if we have a legacy patient who is maybe smoking their legacy cannabis but is struggling to vape, and with the nurse you can have that human conversation, you can be honest with your nurse, right? And that's the beautiful thing about this relationship. So it does influence my practice in terms of me being more human towards my patients, because I understand where they've come from. But ultimately, we still follow like the gold standards of practice, and actually developing our own gold standards of practice within cannabis as well. You know, what would we be using for PTSD patients? What would be looking at for the approach with someone with autism, you know, for example. So it is really interesting. And again, these things are all just developing. We're still learning anecdotally. But yeah, it's a really, it's a lovely perspective to come from, definitely.
No, I appreciate you sharing that. I specifically love how open you are about, you know, the patient sort of situation they might be in, you know, specifically when, you know, you say they may be smoking legacy market cannabis. I know that, you know, because of the legality, it's often very scary to just share with your doctor that might very well be the case. So you can actually get some real help for it. So I really appreciate you all answering these questions. We do have a couple of general questions, but given the time, what I think I'll do is I'll pass over to Sky, and then she's going to ask some of the questions from the Q&A section of the Zoom, and then hopefully if we've got some time, maybe we can come back to these ones at the end. So Sky.
Hi everyone, hi. First question is for James. Do you know when the Integro portal will become live for patients? It was meant to be in March.
Yeah, I don't, unfortunately. What I do know is there's a lot of back service managers and working on it a lot. So we've got Louise and Claire who are really working hard on it. It's a priority for us, definitely. But I don't have a sort of a date at a time. What I can do is come back to you with that, without a doubt. Yeah.
Thank you. It's a question for Mark. Sometimes UK patients receive medication grown many months ago. Will Glass Farms location mean fresher medicine for us all?
Yes, is the short answer. You know, our goal is to, I think, you know, our philosophy is that once it's properly dried and cured, it should be delivered to the patient as soon as is possible after that. And it, you know, it has been the case in the UK that some of the flower is years old. And that's not really optimal from a medical point of view. I mean, we really want to be getting it absolutely consistent. So the answer is yes, we'll be able to supply with a much shorter supply chain.
I think all patients are going to be happy to hear that, definitely. Excellent. So we've got one that says, do any of the industry members that are present this evening foresee changes or overhauls coming to the current prescribing format as to make it less constrained to access within the next 5 to 10 years compared to our current system?
I'm just going to jump in then. What do you know, James, about when does the e-prescribing come in? Because I know that will probably help things a lot.
That again is something that's kind of been worked on the background. There's a few technical issues with that around about the actual systems they use to communicate with each other in the NHS core, which is the system that we would have to use to do the electronic prescribing. There isn't a clinic that's got it done just yet, but there is some issues around it. I think there's some technical issues because it wasn't entirely designed for the private sector. So that's the issue. Yeah. Been a wee while since I've looked at that actually. Sarah, yeah, it's been a wee while.
Thank you for that. Sorry for just butting in. What was the original question before I butt in?
The question was, do any of our guests foresee changes or overhauls coming to the UK current prescribing format to make it less constrained to access within the next 5 to 10 years?
I think, like I said earlier, you know, the hope is that we, you know, can we get GPs to do initial prescribing, initial consultations? And again, I think over the next 5 or 10 years, it's going to be interesting because we've just had Germany who've effectively legalized their market, right? So, you know, it's I don't know, it could go any way. At the moment, it doesn't look like it's going anywhere, but that I think will change. That will change.
If you want to look at a well-regulated medical market, I think that Australia is showing the world a great example of what can be done. And really one of the key things there was that you had a regulatory environment where basically people were listened to and GP prescribing was allowed. So, I mean, what we've got there is an effective model that hopefully we can persuade this country to follow, because the consequences of doing that in Australia have not been a sort of dramatic increase in the amount of cannabis being used. It's just basically people using it in a safe way. So I would hope that this country would begin to look at improving the regulatory environment, because at the moment the demand that you go to see a specialist is effectively just a huge bureaucratic and expense hurdle that really doesn't need to be there.
I look forward to seeing GPs being able to prescribe, definitely. Does anyone?
I wonder if we might get to a model. When I was working in addiction, specialist nurses used to go to GP practices 1 day a week, and patients who had opiate addiction would be prescribed either buprenorphine and methadone, but the specialist nurse would go into the GP practice, see the patients, and then ask the doctor to prescribe X dose. And I wonder if we could get to that model where a specialist nurse like myself or James or even a non-nurse goes into a GP practice, and patients who do have access to medical cannabis can see that nurse, do a review, and then the doctor write the prescription for the medication. I wonder if we could get to that model. At least that would be a step forward than now. But I know there is a lot of work going on to support GPs in prescribing cannabis at the moment.
Great, thank you. There's a question for Graham. Are the Releaf cannabis storage jars classified as being a legal storage method for medication? As per previous understanding, I thought legally speaking, medical cannabis has to be stored within its original packaging.
This is a perfect question, personally, for me, because you're completely right. You're completely right. The jars, you're not supposed to take your medication out of its packaging, not just for the reasons of it then looking like it's from the legacy market, but also for contaminants from air or water. So we're going to be reducing the size of the container, so that when any flour that's ground up, any excess flour that's ground up, only that is then kept in the jar because it's already ground up. But that's an excellent question. And the jar, it was not designed to take outside the house at all. If you saw the jar there, it's definitely not pocket size. It's bigger than it actually probably looks in Mags's hand, but we're reducing that as well, because we don't want to encourage patients to take the medication out of its packaging, put it in the jar, and then take it into the community, because that then also could lead them to unwarranted interest.
Thank you. We've got one. Is anyone planning on producing or importing some Shiska berry? The one from NGC was amazing for my anxiety, and it took me a year to find one that works as well. Anybody?
Shiska berry hasn't been around for a while, has it? And it was very popular at the time. I can't comment because I don't bring in flowers and I don't grow flowers. Obviously, we're very reliant on licensed producers that fortunately bring products and grow products for our patient group. So I'm probably not the best person to answer that.
I can't say that we are doing Shiska berry as a cultivator, but I can speak to the patient and say that and this is as a cultivator, not as an importer looking for different products, but it takes us, I think I've answered this previously, but it takes us at a minimum about 9 months to go from no products to having a product that's in a state that can be shipped, let's say, to any market. And so the decisions that we take them 9 months before you see, at least 9 months before you see a product on the market. And oftentimes the patient will say, well, this really works for me. And we were like, oh, well, damn, like we wish we could supply this to you now. But in order to be able to do that, it's not, first of all, it's procuring the right genetics. It's growing, it's looking for the different phenotypes that you get. It's growing that mother stock out. At Medcan, we exclusively grow from clones. So it's about then stocking your mothers, finding the right pheno, cloning your mothers, testing out whether the batch worked, whether the batch didn't work. So takes a really long time to bring a new product to the market, and the decisions we make are not based on, I wish we could base them on patients saying, we want this, we want this, we want this. That's definitely a consideration when we decide, okay, what product do we bring, what product don't we want to cultivate? But there are a number of other considerations as well. But that's definitely one important one, is what do we think the cohort wants? But again, it's a 9-month delay. So a lot of time, what a patient wants today in 9 months' time is different to what they want in 9 months' time. So, yeah, so there's a bit of risk.
Thank you. Thanks, Miceal. There's a question from Discord. Could something not be put in place so new products can be provided as samples or testers to patients as a way to getting product feedback back regarding the effects and how it helps our medical conditions? Surely real-time data and personal experience is always good for future cultivation and product quality.
I'll answer that. We'd love that. If someone wants to build that for us, we'd absolutely jump on top of that. No, so seriously, patient feedback is probably the most important thing for us as a cultivator. And I've spoken to James about this at length, but like hearing back from the patient and understanding, does this work for you? Doesn't this work for you? What are you taking the medicine for specifically? And I'm talking to our strain. So as a clinic, someone can speak about as a clinic how effective it is, but for us to know that our strain's working for some conditions and not working for other conditions, whether they like the product. The story I tell people often is that, when we first brought our original birthday cake, which people loved, a lot of the feedback was that the trimming was poor. And so we changed how we trim the flower, and we exclusively moved to hand trimming. And that feedback loop, we wouldn't have been able to make that decision had we not heard the feedback from patients. And so I would say to the patient that we as a business, as a company, are always looking to engage with patients and hear your feedback. So if you want to give us feedback, we are active on most of the social channels, but if you want to email us your feedback. We love that patient feedback loop. It's super important for us.
Fantastic, thank you. It's a question for Mark. When do Glass Farms expect to bring flower to the market?
So where we're at the moment is we're doing commercial harvesting and drying and curing. So it's pretty close. Don't like to kind of put a date on it because essentially we're in the midst of processes, but I would say weeks rather than months.
Wow, that's really exciting. What's your price range? Is it going to be variable price ranges, or where's it going to sit on the...
Yeah, so I did cover this, or attempt to cover it a little bit earlier. I think that rather than getting into the specifics, because essentially we're a cultivator, so we have to, we're putting our flower into the market, and there are other, partners that we have in the supply chain. So it's not something that we determine, all of the aspects of that. But essentially, I think that we'll have a range, and it'll be kind of in the middle of the market at the beginning. Is our kind of view on that.
Brilliant, thank you. And then we've got one last question, which is it likely that hash products may be introduced to the vaping category? To anyone who wants to answer.
I think it's really hard to get acceptance for flowers sometimes. I don't know. I guess if it's a difficult one, isn't it? These sort of new, especially something like that might not look traditional.
I don't know. I can just give a little bit of light to the patient or the person that asked it, not in terms of whether I think they're going to be introduced or not, but just as a cultivator growing cannabis flower, if we decided that we wanted to produce hash, it wouldn't be a case of just, okay, let's produce hash. Like, our license very clearly stipulates that we can only cultivate flower. If we wanted to then go and produce hash from our flower, we would either need to get our license amended, which would take months, if not years, or we would need to find a partner that's got the relevant licenses. So it would add an additional step to the process, would add additional costs. And producing hash, we haven't tried. We've produced oil, so from an oil point of view, the efficiency, you have to grow a lot of flower to really get a little bit of oil. And my hunch is that the same is true for hash, that you would need to grow a lot of flower to get a very little, or a rather low amount of hash. And so the commercials don't make sense. Those are we haven't looked at hash, but those are my views, or kind of what I would think. The licensing requirement's a tough one.
Thank you. I think it would be quite popular though. It seems to be quite a lot of patients that do ask for hash, but yeah, it sounds complicated. And one last question, question for Graham. Why do you think we need to confuse patients with a card scheme? So
I'll put that back to you. Are we confusing patients? Is that what you're saying? We're confusing patients?
I don't know. I didn't write it. Sorry.
Just to jump in,
Yeah,
just to jump in, I was just going to butt in, Sky. I think that she's not, don't want to step on ourselves, but I think that a lot of people think that possibly adding another card scheme in may confuse things, because we have seen similar schemes in the past with like Can Card, etc., and we're all very wary, basically.
So it's not our ambition to confuse anybody, the market, patients, or anybody. If there's a real consensus that we should stop giving patients our card, then absolutely, that's fine. As far as I'm aware, there's our card that we give with our vape pack, our starter pack, and there's the Can card. Are there other cards I'm not aware of? And that's a genuine question. I'm sorry.
There's the Cando one as well.
There's a few, yeah.
Okay, well, like
not to name and shame. It's just, I think it's like Sarah says, it's a concern that if perhaps like you say, you're catering to the public and the cannabis naive, if their first influence of medical cannabis is only the Releaf clinic, which is obviously something that is going to be done by the targeted marketing, like you said, that may come to the conclusion, like it says on your website, that as you offer the first medical ID card, that is what is required of a patient in order to validate themselves in front of an officer or somebody in a place of authority.
Yeah, no, it's a really good point. It's a really, really good point. The card was to give cannabis naive patients some form of security that they could, if they were stopped, they could present it. But I genuinely, if patient support groups, which are, astounding, they always have been in every disease area I've worked in, are so supportive that if you really think as an organization that we should stop giving out the card because it's confusing the industry or the patients as a whole, and it's confusing the medical cannabis field, then let us know and we can stop that card. But it was not designed to create confusion. It was not designed to be a competitor of Can Card or any other card. It was just, so you've not had cannabis before, we're giving you a vape machine, as you know, what Mags presented, but it was never intended to confuse the market. And if that's what you think we're doing, then please just say it.
But just put in and think, I think you are a little bit, it is confusing for the market with the card. And I think it's great that you're giving out a vaporizer. I think a lot more clinics should give out vaporizers because they're very expensive and a lot of people would rather smoke it than spend £100 on a vaporizer. But yeah, I don't think the card, none of us think the card is a very good idea. But what you could possibly do is put an MCPA flyer in with the box or something like that, so they can come here and learn about everything. It's just about awareness and the patient.
I will say we don't represent every single patient in the community. I think it's great that you're making those considerations. I think it just draws back to the conversation earlier about patient consensus, because of course there are some patients that will certainly see the benefit of having a card such as yours, but obviously there are the patients that do have concerns as well. So should we Sky, have you got any more Q&A questions?
No, we're done.
Okay. We've got about 15 minutes. If you're happy for me to carry on, everyone's still wide awake, I can ask the two general questions that we'd like to put to all of our guests. Yeah. Okay. I'll just see any nods now. Okay. So this question's asked in part by a retired NHS nurse. What advice can you give to patients and prospective patients who are trying to navigate a legal market that is marred by misinformation and ignorance? Generally speaking, the police still don't know how to adequately deal with medical cannabis patients, and many NHS doctors are unaware that cannabis-based medical products are even legal. The legal minefield and long-standing stigma surrounding cannabis adds extra stress to to patients who are already ill and often struggling to cover the cost of their private treatment. So the original question there is, what advice can you give to patients and prospective patients on this in the legal market?
I would say just be careful of services selling bells and whistles, you know, to sell the products. Be careful of that. Look at the reviews of the service. And in terms of stigma, I would absolutely be talking with, you know, directly with your healthcare provider around about how to have those conversations. And certainly, you know, all of my patient group, I will be having those conversations with them every time I meet with them if it's an issue. We can also write letters, we can speak to people on the phone, and sometimes it can really help having that supportive healthcare provider, you know, whether it's your nurse, your doctor who cares about you, willing to have that conversation with other healthcare professionals within your team. And again, just being that link, but your clinic is really best placed to guide and support any advice there.
Appreciate that. Is there anyone wants to? Yeah.
Yeah, I'd just add to that. It's a minefield, isn't it, right now? There's cannabis clinic, there's what, 30, 35 cannabis clinic, and there's more and more coming through. So if I was looking for a clinic, I'm not sure I'd know where to start, but what I would do is I'd probably look at, I don't know, the top page in Google, and I would call the clinic and see how I was treated by the person on the other end of the phone. And if I was treated compassionately, you know, and felt comfortable, then I would probably choose that clinic. But you're never committed, are you? You're not committed to staying with the clinic. If you join a clinic and you find that the service isn't supportive or it's not as you thought it would be, then there are other clinics. But I get it. It's so difficult when there's so many clinics all promising to deliver the best, you know, that they possibly can. So I would just say, call up the clinic, whoever you choose, and speak to somebody on the other end of a phone, not a machine, and see how you bond. Do they sound that they know what they're talking about? Are they empathic? You know, everything that we would all expect as a patient.
Thank you. I think Max wants to share something.
Firstly, just to say, completely reiterating what Graham just said, I think the care and the humanity that comes across from just having a conversation with someone on the phone is so important. Just from a more of a legal rights point of view and understanding more legal parameters for patients, I would hope that they would come to patient groups like yourself to be signposted to reputable sources such as the Cannabis Industry Council, who have recently released some great resources around employment, around driving, as has Drug Science, and all of their information is rooted in science. So there are organizations out there that are really trustworthy. And I think it's up to us as the community, as the industry, to ensure that we're aligned in where we're signposting patients to, so that we can help them and handhold them when it comes to navigating the very confusing industry that we all work in.
That's brilliant. I definitely agree with the point that patients should have access to those resources to make it much easier. So that, for example, like you said, the booklet that was put out by the CIC, I managed to get myself a nice hard copy from the conference, so we keep that stashed away in our car in case of any trouble. So I really appreciate you sharing on that. Is anybody else on this point before we ask our last question? No. Okay. So how do you feel the MCPA can contribute to continue to facilitate change within the wider industry? Are you or the organization you work for able to support us in reaching our goals?
One thing about medical cannabis is that all medical cannabis reform has been patient-led all over the world. That's basically what it has been. It's been a patient movement. If you go back to its origins in California, that's what was happening. So I think that it's absolutely pivotal. Essentially, that, I mean, you know, whatever we can do to support the patient organizations, we will do. It is fundamentally a patient-led movement. And I think, you know, when you asked the previous question about what advice could we give to patients, I think that I don't really see myself in a position of giving advice to patients. I think that it's more that there is a collective struggle that we need to undergo in order to actually make this a rational and accepted part of medicine. And these are the rational stigmas that we're actually dealing with, and there is plenty of evidence for developing a much more compassionate way of doing this. So I think that, I mean, whatever way we can possibly support patient organisations, we will always do. As a cultivator, I think it's it's just an essential.
Yeah, we'd echo Mark's point of view. I think as a patient organization, if the MCPA can provide that feedback loop, I think these webinars are extremely effective. Hearing questions and hearing often what is on the mind of the patient is not necessarily the first thing that we think about, which is really interesting. So it's always good to hear the feedback and what's concerning patients, and just making sure that there is that level of sort of communication is super important and super helpful, and I think it'll drive things forward. Again, like the trimming, we wouldn't have changed our trimming mechanism or our trimming ways if we hadn't heard so much from patients. And so that's just, if you could act as that feedback sort of conduit, let's say, and getting everyone around the virtual table like this is super helpful. So yeah.
Patients changed the law, didn't they? So let's keep it going. Let's keep it. Billy and Charlotte changed this law, so let's keep that going.
Max, you want to share on this last point?
Yeah, I think what's already been said about the medical cannabis card and this kind of ongoing debate is a really great example of how we can work with groups like yourselves to get an idea of where there might be room for improvement, and where patients have got their ideas of their own that we can be inspired by. And of course, it's up to us to run our own, focus groups and do surveys and all that stuff. But you guys can help feed us thoughts and comments that we can then look into and do that necessary, qualitative and quantitative research at our side. I also think that patient groups have a hugely valuable role to play when it comes to creating spaces where patients feel safe to voice concerns, and where they know that there's not going to be any kind of biases from industry at play. And I want to bring up at this point the patient conference that I was responsible for running with Drug Science last year. It might not happen this year, and I would love something like that to happen this year. And so I would kind of really call upon people like yourselves to work with industry to make sure that there is a space where people can come together in person and online in an even larger way. But I want to also commend you guys for having these regular, like, weekly meetings where patients' voices can be heard, because I think it's so vital.
Absolutely. I agree. It's very powerful for us to have that connection that otherwise wouldn't be there between patient and the industry. And I certainly agree on the point of us trying to have both a virtual and a physical presence. Is certainly something we've looked into in the past. And I think, like you say, having something in person like the conference is certainly very validating, just to be around other patients as well. So lastly, James, did you have anything you wanted to add on this point specifically at all?
I am a union man. I am all about unified voices. I think it's fantastic, and it's essential. I would echo what everyone else has said here as well, that it really has been patient-led, right, from wherever you look at, and let's keep that going. Let's keep it going.
Yeah. And on that point, I just wanted to butt in and say that we are hoping to have our first event at some point this year. I think it's our Discord's a year old in July, but the MCPA is officially 2 years old in November. So we are hoping to do some kind of massive bash for patients that we get together.
Sounds great. I'm up for that.
Brilliant. Thank you, everyone. So if that's everything, shall I just ask, is there anybody who wants to put any closing statements, anything across to patients now, as this is your very last chance? No? Okay. All right. I'll pass back to Sarah to see if there's any reminders she wants to give us.
Yeah, I'll just go through. I think we've got, just a quick reminder, we have the Vape and Chill meetings on a Friday. at 2 p.m. and on a Sunday at 2 p.m. where patients can just come and chill and have the medication, talk to people about, you know, what's going on and relax. We have the more structured meetings on a Wednesday at 6 p.m. where you can come and talk about what problems you've got going on, etc. And we'll have we've got a 4:20 live event in April, so there'll be like an all-day thing from like 3 p.m. with competitions, games and things like that, loads of stuff going on, video streaming. So that should be a really good day, like a virtual 420 for people who, you know, a lot of us can't get out of the house, so we'll do it online this year. But I think, yeah, that's more or less it. There's no more anything else to talk about, but I just wanted to thank everybody for coming today. I think it's been a really, really good webinar, and I learned lots of stuff myself on these every time I come on, so it's always valuable, and I'm sure it is for everybody else. And I hope that we can all continue to work together, because like Karen said, I think, you know, bridging the gap between us and the industry is, you know, we can figure out what the problem is and get it sorted. So that's it. I'll keep it short and sweet. Thank you everybody for coming, and I hope to see you all next time.
Thank you very much. Thank you, guys.
Thank you.
Bye,
Thank
everyone.
you.
Bye now. Bye.
Thanks, guys.
Bye.